Hi, I'm Dr. Jeff Kleinheinz from Kleinheinz Dentistry. Today we're going to talk about SureSmile. SureSmile is a clear aligner therapy that we do here, which is just like Invisalign. SureSmile differs from traditional wires in that it doesn't have any wires. Sometimes the system will ask us to bond a little tooth-colored filling onto the tooth so that the clear plastic aligner can move the tooth a little better or more efficiently. Because there's a layer of plastic for the aligner over your teeth, everything is really smooth on the inside of your lip. Frequently, if you had brackets or a wire, that kind of irritates the inside of your lip and gives you a little blister, a little wound. And so SureSmile doesn't have any of that stuff, so it's a lot more comfortable to wear. Those who have had wires in the past when they were a teenager, now as adults, they can get their teeth straightened with SureSmile, and it's a lot more comfortable. It hurts a lot less to move the teeth than the wires do. SureSmile is easy to fit into your adult lifestyle because a lot of people can't even see it. So it might be in your mouth, but I wore them when I was treating patients, and I said, SureSmile would be a good thing for you. And they said, well, I don't think I want to do that. And I said, I'm wearing them right now. Can you tell? And they said, no, I couldn't even tell it was in your mouth. So it's very invisible, kind of like Invisalign, right? But our version is called SureSmile, and it can be very comfortable, and it can do a great job to get rid of those crooked teeth that have always bugged you. So the way you work with clear aligner therapy in our SureSmile is that you have to have the plastic in your mouth or it won't be moving your teeth. So you keep them in 24/7. But the neat thing about them, unlike wires, you take them out to eat, and you can take them out to brush and floss your teeth after you eat, and then you put them back in. So with the wires, it's really tough to get the floss in between. But with SureSmile, you just clean your teeth after you eat, and you pop them back in. As a minor little note, some people think it's inconvenient to take them out to eat. So on average, on our full cases, people lose 8 pounds. It's not promised, but they're not snacking. They're not grazing. And so they're just leaving their aligners in and not taking them out, so they don't eat as much during the course of the day. The way SureSmile moves your teeth is that you wear an aligner for about a week, and each aligner moves your tooth a small increment. And then, so when you take the first aligner out and put the second one in, it feels a little tight, a little snug, but it's moving your tooth another fraction of a millimeter. So if you have 14 aligners, it's moving your tooth each time a little bit. So it's not always moving all the teeth at one time, but just increments. When you have wires, they're moving them all the time, and it really hurts when you get them tightened and stuff like that. But SureSmile is a whole lot more comfortable, and it can, again, move your teeth incrementally, and slowly, gradually, your teeth get straighter, and now it's easier to floss if they were real crooked before. The time frame for treatment with SureSmile can vary. If your teeth are really crooked and need a lot of straightening out, it'll take longer. In ballpark, most of our patients are done in about 12 to 18 months. But if you have just a little bit of movement that's necessary, sometimes they're done as few as 3 or 4 months, wearing one aligner a week, for however many you get. And so that works out very nicely. So is it faster or slower than wires? Some say, depending on the movements, it's a little faster than the wires. So if you're interested in SureSmile, check out our website or give us a call today so we can schedule you a free consult.